The health and community services industry will have 26% of the new jobs in Queensland in the next 5 years. So for all of us employers, we've got an issue with recruitment.
I certainly think that adopting the partnership model was the most successful way to deliver this work inspiration program, because right from the start we had all 6 partners involved, so the 5 organisations plus the school.
This opportunity to provide our soon-to-be senior students with first-hand experience of a number of workplaces that were working in the health industry just seemed too good to miss, and it proved to be so.
Well, I thought it was very important to create a different type of work experience for students. We've been involved in work experience through different avenues, through Queensland Health and just directly with schools, and this was an opportunity to allow the students to have a completely different and varied experience.
Giving students the opportunity to see the varieties of health platforms and opportunities for the future, and particularly to capture an area such as youth health.
Well, we went to the different organisations and we had a little, basically a snapshot of what they did on a daily basis, and that was really interesting.
The first insight to All About Me, we used the My Career Match, which is an online career profile. It allows the students to investigate their strengths, to investigate areas where they can improve on.
I really enjoyed the week because of the experience that I gained. I come into this week with a couple of options, and at the end of it, it's opened so many more up.
Behind the scenes was fantastic for the students, because students, or people in general, get bombarded with various marketing messages. So when it comes to Indigenous health, in particular Aboriginal and Torres Strait Islander people, this is unknown. So what we tried to do was give them a bit of a glimpse into the culture, first and foremost, but really strip it down to basics.
We had the kids actually doing some hands-on activities. So, for example, we blindfolded some of the children, partnered them up, and they fed each other M&Ms. Gave them that feeling of what it feels like to be unable to do that yourself, and it was around the person-centred care, which of course is where the industry is heading. There's a high focus on person-centred care.
Third Inside Careers Happen is an opportunity for students to talk with health professionals about their current careers and the journeys that they've taken to arrive at that point. And I think this is really important for students. They set their sights on a particular career or a particular discipline within health, and yet when you interview staff, you really learn that it's not a linear progression, that staff may start at a point and they'll take a varied course, different pathways. There's a whole variety of opportunities for students.
Because I want to go into psychology, and it was really interesting hearing about their jobs and why they got into it and what they do in a normal day. It was really good. It was nice being able to, do the activities with them, so we weren't just sitting and watching, we were actually involved.
My staff were already organising for the next time, so they're already planning what to do next time to make it even more hands-on.
This group actually applied to be part of this, and they really wanted to be there, and I think that made a difference because they were genuinely interested in the industry and wanted to learn what was available for them.
The staff in organisations had to sit back and think, well, what is attractive about their job, what are the good bits of it, and think through that primary care pathway, which is really important.
Any industry should jump at the chance of engaging students in the way that we engage them.
We as a school are delighted to form partnerships with community organisations. The fact that we've had 5 partner organisations well respected in the community join with us, and this is a boon to us. So I would strongly recommend to any of my colleagues as principals in schools that they be part of this program, and I hope that we can in the future be part of it again as well.